Diabetes is one of the fastest-growing health concerns worldwide.
From early warning signs to the best diagnostic tests and daily diet tips, here's a complete guide with doctor insights to help you manage blood sugar effectively.
Diabetes is a disease in which your body struggles to process blood sugar, or glucose.
Normally, your body transports blood sugar into your cells, where it is converted into energy, using the hormone insulin.
However, this process malfunctions in people with diabetes.
Sugar accumulates in the blood as a result, which over time can damage your heart, kidneys, eyes, and nerves.
This article is reviewed by Dr. Ashok Kumar Jingun, Senior Director, Center for Diabetes, Thyroid, Obesity Endocrinology, Bookmax Super Speciality Hospital. Diabetes is a chronic health condition where the body either does not make enough insulin or cannot use it effectively.
This causes high blood sugar, which can damage organs over time. The main types are type 1, type 2, and gestational diabetes. Type 1 diabetes children or young adults are usually the first to develop type 1 diabetes. It has nothing to do with lifestyle or diet. It is an autoimmune disease in which the body's defense mechanism unintentionally targets the pancreatic cells that produce insulin.
Insulin must be taken daily for people with type 1 diabetes to survive. Type 2 diabetes, although it typically affects adults, more children are developing type 2 diabetes as well. Connected to lifestyle factors such as having a family history, being overweight, or not exercising. Healthy eating, exercise, and occasionally medicine or insulin can help manage it. Gestational diabetes, the mother's body may have trouble using insulin due to hormones from the placenta. Usually disappears once the baby is born. However, there may be a greater chance of type 2 diabetes in the future for both mother and child. According to the IQRINDIA study, about 11.4% of India's population now has diabetes. This translates to over 100 million people. Urban prevalence stands at 17.2%, while rural areas are catching up at 9.4%. A comprehensive meta-analysis covering 197222019 showed that diabetes rates jumped from 3.3 to 19.0 in urban areas, and from 2.4 to 15.0 in rural areas. National NCD survey data also reveal that urban diabetes prevalence is over 14.3, compared to 6.9 in rural regions. A broader global context, India hosts around 212 million diabetics, more than any other country. Historically, urban areas had around twice the diabetes rates of rural areas. But over time, lifestyle changes and urban influences are making the rural-urban gap narrower. Rural diabetes went from 23 decades ago to nearly 15 now. Cities are not that far ahead anymore. A study at TRI in southern India reported a steep increase in type 2 diabetes among younger people from 4.5 to 7.8 over 10 years. Older adults rose from 28.4 to 34 in the same period. Even more striking, the rate of increase was much higher among the youth. 120 rise in new cases, compared to 150 in older adults. Relatively, that's a bigger jump in the younger group. Risk factors: more families have a diabetic history, weight gain, less activity, and more sedentary routines, all pushing youth into early diabetes. In Ranchi, cases of type 1 diabetes among children under 14 have climbed from single digits to 12-15 cases annually now. From 2024 to early 2025, 12 new cases were reported alone. Nationally, there are nearly 95,600 children under 14 living with type 1 diabetes, and about 15,900 new cases are diagnosed each year. Young Indians face a soaring diabetes risk. Overall prevalence among youth is 12.3 for boys and 8.4 for girls. Alarmingly, diabetes in youth tends to be more aggressive, with complications like heart, kidney, nerve, and eye issues showing up sooner. Imagine someone in their 20s or 30s still energetic, bustling through life, suddenly told, "You've got diabetes." It changes everything. The first symptoms of diabetes include frequent urination, excessive thirst, fatigue, blurred vision, and unexplained weight loss. These signs develop because high blood sugar affects the kidneys, vision, and energy levels. If these symptoms appear, consult a doctor for a simple blood test. When diabetes begins to develop, your body starts sending signals, but they can be subtle. Many people ignore or brush them off as just getting older or being tired. Here are the main early signs. 1. Frequent urination, especially at night. You might notice you're running to the bathroom more often, even waking up multiple times at night. Why? It happens when sugar builds up in your blood. Your kidneys try to flush it out through urine. This means more trips to pee. 2. Excessive thirst. You feel unusually thirsty even after drinking water. Why? It happens you are losing more fluids than usual through urine, so your body keeps asking for more water. 3. Fatigue. Always tired. You feel drained, sluggish, or mentally foggy even if you slept okay. Why? It happens your body can't properly use sugar, its main energy source, so your cells are starved for fuel. It's like having a full fridge with a broken power supply. 4. Blurred vision. Your eyesight may seem off, things look fuzzy, or you struggle to focus. Why? It happens high blood sugar affects the lens inside your eyes, causing swelling and blurred vision. It may come and go. These symptoms aren't always dramatic but can be just as serious. Feeling low, anxious, or irritable can be a metabolic issue, not just mental health. Seniors may nap more, feel tired all day, or become less interested in daily activities. A decrease in hunger or skipping meals may seem normal, but can be a red flag in diabetes. In elderly people, symptoms are often mistaken for aging, which delays diagnosis. Regular checkups are key. Genetic factors. Sometimes, health issues run in families. If your parents or close relatives have a particular condition, you may inherit a tendency toward it. It doesn't mean you will definitely get it, but your risk can be higher simply because of the genes you carry. Lifestyle factors. The way we live our daily lives has a big impact on our health. Eating too much junk food, not exercising, smoking, or drinking alcohol can slowly harm the body. On the other hand, healthy habits like balanced meals, regular activity, and avoiding harmful substances can protect you. Obesity and insulin resistance. When extra weight builds up, especially around the stomach, it puts pressure on the body's natural systems. Over time, the body may stop responding properly to insulin, the hormone that controls blood sugar. This makes it harder to maintain healthy sugar levels, which can lead to bigger health problems. Stress and sleep. Stress is more than just a mental burden. It triggers changes in hormones that affect blood pressure, weight, and sugar control. Lack of proper sleep adds to the problem, making the body more tired, hungrier, and less able to manage stress. Together, poor sleep and high stress can quietly increase health risks over time. High blood sugar can damage the tiny blood vessels in the eyes. Over time, this can blur your vision, make it hard to see clearly, and in severe cases, even cause blindness if not treated in time. Your kidneys act like filters, cleaning waste from your blood. When diabetes is uncontrolled, the extra sugar damages these filters. Slowly, the kidneys may stop working well, which can lead to kidney failure and the need for dialysis or a transplant. Diabetes puts a lot of strain on the heart and blood vessels. It increases the chances of high blood pressure, heart attacks, and strokes. In simple words, untreated diabetes can silently damage the heart, sometimes without clear warning signs. Too much sugar in the blood can injure the nerves, especially in the hands and feet. This may cause tingling, numbness, or pain. Because of the numbness, small cuts or wounds on the feet may go unnoticed, which can turn into serious infections and, in the worst cases, may even require amputation. Doctors diagnose diabetes using blood tests like fasting blood sugar, HbA1c, and random blood sugar. A fasting level of 126 mg/dL or more, HbA1c of 6.5 or higher, or random blood sugar above 200 mg/dL confirms diabetes. Doctors usually confirm diabetes with simple blood tests. You should get checked if you. The good news is these tests are easily available at almost every pathology lab, clinic, and hospital across India. Many health camps and government hospitals also offer these at low or no cost, making them accessible for most people. While diabetes affects everyone, it often plays out a little differently in women, not just in how it develops, but also how it feels and what it affects in daily life. Coase polycystic ovary syndrome is a hormonal disorder that affects about 1 in 10 women of reproductive age. Many women with Coase don't realize it puts them at a much higher risk of developing type 2 diabetes. Why? Coase is tied to insulin resistance, meaning your body doesn't respond well to insulin, the hormone that helps manage blood sugar. When this happens, your body has to work extra hard to keep blood sugar in check. Over time, this strain can lead to type 2 diabetes or prediabetes. What to do if you have Coase? It's a good idea to get screened regularly for blood sugar issues even if you feel fine. Gestational diabetes shows up only during pregnancy, usually around the 24th-28th week. It happens when pregnancy hormones mess with the way insulin works. You didn't have diabetes before, but your body struggles to control blood sugar while pregnant. It usually goes away after birth, but it increases your risk of type 2 diabetes later in life. It can also increase the baby's risk of developing diabetes or obesity later on. What to do? Gestational diabetes is usually managed with a special diet, exercise, and sometimes insulin. Prenatal care is key. While classic diabetes symptoms like fatigue, frequent urination, and thirst show up in both men and women, women often experience some unique or different signs, especially when blood sugar stays high for a long time. Mood swings or depression. High blood sugar can affect how your brain uses energy, leaving you foggy, irritable, or unusually down. More frequent infections. Women may experience more yeast infections, urinary tract infections (UTIs), and bacterial vaginal infections. High blood sugar feeds yeast and bacteria, making infections more common. Sexual discomfort or dryness. Diabetes can reduce blood flow and nerve function, leading to these are often underreported but very real irregular menstrual cycles, especially when diabetes and Coase overlap. Insulin resistance can mess with your hormones and throw your cycle out of whack. Fatigue. That's more than tired. This is not just being sleepy. It's a dragging exhaustion that doesn't go away with rest, like walking through life with weights strapped to your legs. There is no permanent cure for diabetes. However, blood sugar can be controlled with lifestyle changes, medication, and insulin for some patients. In some cases of type 2 diabetes, remission is possible through diet and weight management. Diabetics should avoid refined sugar, white rice, sugary drinks, and deep-fried foods, as these raise blood sugar quickly. Instead, focus on whole grains, vegetables, pulses, and high-fiber foods to keep sugar levels stable. In addition to receiving medical care, many diabetics look into natural or Ayurvedic treatments not as a cure, but as support. These treatments seek to strengthen the body's natural systems, enhance digestion, and help regulate blood sugar. Let's go over some frequently used herbs and spices, many of which you may already have in your kitchen. Methi seeds can improve how your body uses insulin and may help lower blood sugar after meals. How to use: soak 12 teaspoons overnight in water, and drink the water with or without the seeds in the morning on an empty stomach. Cinnamon may improve insulin sensitivity and help lower fasting blood sugar levels. How to use: add a pinch of cinnamon powder to warm water or herbal tea daily, or sprinkle it on oatmeal. Known as the root of immortality in Ayurveda, giloy is a powerful adaptogen. It may support blood sugar balance, reduce inflammation, and boost immunity. How to use: usually taken as a juice or in tablet form, available at Ayurvedic stores or pharmacies. Note: not recommended without guidance if you're pregnant, breastfeeding, or on multiple medications. Jamun is famous for its sharp taste and sharp benefits. The fruit and seeds may help slow sugar absorption and improve insulin activity. How to use: fresh jamun when in season, or powdered jamun seed, available in health stores with warm water on an empty stomach. A gentle but important reminder: these remedies are not a substitute for medication or medical advice. Interact with your diabetes meds. Consult your doctor before trying new remedies and monitor your blood sugar levels regularly. Treat Ayurveda as complementary, not your only line of defense. If you know you're at higher risk for diabetes, you're not powerless, far from it. The good news is that small, consistent changes can delay or even prevent diabetes altogether. Let's talk about some of the most important and realistic things you can do. Let's be real, this isn't about chasing skinny. It's about reducing pressure on your body so it can work better. Why it matters: even a 57 drop in body weight can lower your diabetes risk significantly. You might feel fine, and that's exactly why checkups matter. Why it matters: type 2 diabetes often creeps in without symptoms. Regular blood sugar checks, fasting, and A1C can catch issues early. You don't need to cut everything you love, but how you build your plate matters and can shape your health. You're not dieting. You're simply choosing fuel that helps your body feel better now and later. Early diagnosis, early action. Early action can prevent complications like nerve damage, eye issues, or kidney problems. Why it matters: if caught early, like in the prediabetes stage, lifestyle changes alone might keep you from needing medication at all. Catching it early can mean living life on your terms, without constant medical worries. A diabetes diagnosis can feel overwhelming at first, but many people, from everyday heroes to celebrities, live full, joyful lives with it. They travel, work, raise families, follow passions. They just do it with a little more awareness. Even in the spotlight, many public figures are managing diabetes and using their voice to inspire others. Apart from these celebrities, other celebs like Kamal Haasan, Salma Hayek, Samantha Ruth Prabhu, Tom Hanks, and others are also dealing with diabetes, but these people don't hide their diagnosis, they own it. Diabetes is a long game, but so is life. You don't have to do it all at once. Make room for joy, including dancing, art, and hobbies. Emotional health, physical health. Finding the right balance between science and lifestyle is the key to protecting ourselves from diabetes. While medical advances and treatments are there to guide us, our everyday choices, what we eat, how much we move, how well we sleep, and the stress we carry, play an equally powerful role. Regular screenings act as an early warning system, helping us catch risks before they turn into complications. With awareness, small but consistent lifestyle shifts, and timely checkups, we can stay a step ahead and lead healthier, fuller lives. The earliest signs are frequent urination and excessive thirst, often noticed before other symptoms. Type 2 diabetes can sometimes go into remission with weight loss and strict diet, but it requires long-term monitoring. You can use a glucometer to check blood sugar, but formal diagnosis requires lab tests like HbA1c or fasting blood sugar. Yes, family history.